Yeah, I've had a headache for the like half the day, so if I'm not my usual, if I'm more quirky than normal, I apologize. How about I just say it like that?
Okay.
Okay, we are streaming and we are recording. So go
All
ahead,
right.
Julia.
Great. We are going to call to order the Edina Community Health Commission meeting on March 8th, 2021. And I will start. We're not going to do actually, why don't we do a full roll call? Because we have a new member, so we can all introduce ourselves. Normally we haven't been, but I think it's probably a good idea today. So I'll start. My name is Julia Selles, and I am the chair of the Edina, the Community Health Commission. Should I call on people? Should I scroll through? Sorry, Jeff, I'll let you go, and then I'll just scroll across. Oh, you can't do it.
No,
okay,
I can do it. My screen was, because when you share your screen, you have to go up and do the little drop down at the top. Anyway, Jeff Brown, Community Health Administrator for the city, staff liaison for the commission. So I do the minutes and stuff.
Amanda?
Amanda Her.
Okay. And I have Andrew.
Wait. I think we should do a little tell about yourself.
Okay.
Just a little bit.
There was no prompt, so.
I'm sorry. I'm not good at this.
How about just a little, I don't know. Why are you interested in the health commission or something? I don't know. A little bit of something. Is that fair, Julia?
What if we did like a fun one? Or is
Fun
that
fact. Sure.
sure? Or like favorite ice cream flavor? I don't know. That's my
Yes, I like that. Favorite ice cream flavor.
All right.
I know mine right away. Mint, chocolate chip.
All right.
I like most ice creams, but definitely dark chocolate.
All right. Andrew?
Americans, I've got a toddler, so like I think it's the rainbow one, the 3 different flavors. Like I have to like what he likes, or else it doesn't go well in our house.
I get that. Who's next? I have Mary.
Hi, I'm Mary Absalon. I'm the new member on the Edina Health Commission, and my thank you very much. I look forward to working on this, and I like peanut butter ice cream.
That sounds delicious. Eva.
Hi, I'm Ava DeSimone, and my favorite ice cream flavor is probably chocolate chip.
Greg?
Hi, Greg Wright. I am a pistachio nut person.
Okay. Eva?
My name is Isa. I'm a student member, and my favorite ice cream flavor is chocolate cherry.
Michael. Michael, we can't hear you.
Oh, I'm sorry.
No, that's probably my fault.
Michael Wood, this is my second year on Edina Health and Human Services, and I've got a food brokerage business and a food background of over 30 years. So, and I like vanilla ice cream with a lot of cookie dough in it.
Yum.
Good stuff. Philip.
My name is Philip, and I am autistic and the owner of Today's Autistic Moment, a podcast for autistic adults by an autistic adult. And I would have to say my favorite flavor is Neapolitan.
Like it, a little bit of everything. Rob?
Rob Lesh. I'd have to say my favorite's vanilla, but it's got to have chocolate hard shell on it.
All right. Tracy?
pie, Tracy Nelson, and toffee.
I guess I could go back. So I recently had my husband got takeoff from a new ice cream place, and they have a flavor called the Croning from Baby Zito. I don't know if you've ever heard of it. It's in Minneapolis, and it has it's a takeoff on a popular TV show, and there's like Oreos and peanut butter, and it sound really weird, but it was delicious. Okay, so welcome, Mary. It's great to have you on. Unfortunately, we're still in this virtual meeting setting. So we'll move into the approval of the meeting agenda.
I move to accept.
Okay.
Second.
And who was the second?
Andrew.
Andrew. All right. Anybody opposed? All right. Motion passed. And now we look to approve the meeting notes from the last meeting.
Motion to approve?
Do we have a second?
Second.
Okay. Anybody opposed? Okay. The meeting minutes have been approved. Jeff, did you receive any community comments?
Nope, no community comment.
Okay. Well, I'll keep moving then. So the next thing on the agenda is the chair and vice chair elections. We were supposed to do those last time and it kind of slipped by.
I kind of floated the idea to Julia and Andrew that since we missed a few meetings last year and this came up really fast, it seemed like to me that they would it would be a good idea if they continued as chair and vice chair, but I just thought that would be a good idea.
But if anybody would like to jump in or nominate themselves or somebody else for chair or vice chair,
I'll
feel
second what
free.
Jeff said.
Right.
Me too. Third.
Okay.
Yeah, I mean, I was just thinking back to the fact that isn't this is our 1-year anniversary, right? From the first meeting that we were all in City Hall to going into this status. So it's been a little surreal for the past year, I think.
Yeah, and then we didn't see each other since, so.
Yeah, we just had one meeting, right? Like
Yeah.
one,
Yeah.
and then poof.
If I knew now, if I knew then what I know now, I feel like we would have taken a lot more time to start to build up those relationships, knowing that we wouldn't be seeing people in person for a solid 12 plus months.
Right.
Well, it was March, and then like 2 weeks later, the pandemic happened. You know.
Well,
Okay, so we need an official motion, somebody that's not me. Michael, is that fair? Since
Yeah.
you
Yep.
I'll
And
move
then-
it.
I haven't heard whether that's okay by those two.
They don't have a choice.
It doesn't make any difference.
I'm okay with it.
As long as Julia's okay carrying on in her role, I'll be happy to stay as her deputy or vice.
Okay, I could do it for another year.
Okay, so I got Mike and then Greg, first and second.
Right.
Carry on with your any opposition question.
Are there any opposition? Anybody opposed? If anyone wants to jump in themselves, now's your time. Everyone don't jump at once. Okay, I will take that silence as it's been approved.
Congratulations.
Thank you, appreciate it.
Lucky you.
Oh yeah. Okay, committee updates. So the first committee on social connectedness, we did not meet within the last month. Some things came up. I don't have any updates from that committee. I don't think Amanda does. I see you shaking your head. I can scroll over. Philip, I don't know if you had any comments at all. I don't think so. Okay. Any other subcommittee updates? You know, we should probably actually say what each subcommittee does, and that way Mary knows. And if Mary, you'd like to, if there's one that sounds particularly interesting to you that you'd like to jump in on, let us know. So subcommittee 1, we're focusing on social connectedness. And originally when we brought this up, it's not exactly the same as kind of the path it's taken in the last year, especially with COVID and keeping connected to people. Thank you for bringing up the work plan, Jeff. Great. So that's the first, that's kind of subcommittee 1. So the comments are really, one thing that Philip's working on is including kind of technology and health. Specifically, there's an app, and if you scroll to the last page of the agenda for today, it specifically talks about this app. You can look into that, and I'm sure Philip can tell you a little bit more about that if you'd like. And just kind of dealing with social isolation, and there's definitely been a lot more that's happened in the last year around that. So that's the first topic. And the second topic, initiative 2, is, sorry, my eyes are struggling today.
I
Study
can
and
speak about that one a little bit if you want.
Perfect, thank
That
you.
one. Yeah, so basically our task is to investigate potential policies regarding smoking in multi-unit properties around Edina. Welcome to the commission, by the way, Mary. But today we met with Margaret Perez from Bloomington Public Health, and she had a ton of information for us about her endeavors with like SHIP partnership. And she gave us lots of information about models in California. And also I thought it was interesting because she mentioned how Edina and Bloomington were on pretty similar pages, and how a few years ago she presented to the Community Health Commission about this. And we thought that it would be like beneficial to work together or kind of like coordinate a little more. So would there be any specific like protocol for doing that? And like, would that fall under the responsibilities of like this subcommittee, subcommittee 2? I was just wondering, so.
Yeah, if the committee would like Margaret to come and talk to the whole group, we can definitely do that. She's done that, like you said, she's done that in the past. So it can be a presentation. It doesn't have to be any kind of decision at that point. But yeah, we can schedule that whenever she's available.
The other thing that she brought up though was that maybe a joint venture, and I don't know if cities have ever done that in the past. We work with Bloomington and maybe Richfield on the same initiative for the recommendation to the councils. They've got a city council member that wants this done. But I don't know, has Edina ever worked with another committee, from another city, I guess?
Yeah, so in the past, in non-COVID time, usually in May, well, it used to be March, but we were moving it to May. We have the 3 city commissions meet together. So like we would take one of the meetings in the spring, and we would go to like we hosted it at Arneson Acres Park, or Richfield has it at their city hall, or Bloomington we go to, I think we had it at Bloomington City Hall too.
Yeah.
But we
City Hall.
have dinner, and we all get together in a big room, the 3 commissions, and then you all can kind of share what is being worked on, so that you can hear from each other versus like the staff always translating and communicating and stuff. And in the past, that has kind of generated some healthy competition sometimes. Like when we were working on Tobacco 21, there was a little bit like, whoa, we need to do that stuff. So that can be an opportunity to share ideas and collaborate. I guess we're not doing it this year, obviously, because of the pandemic, but some kind of sharing, like we've talked about, do we have a meeting where it's like the chairs get together on Zoom and talk, or something like that, to share ideas. So yeah, that's totally not out of the realm of possibilities to collaborate and share plain, similar language and approach councils with recommendations at a similar time.
Yeah, because what we're finding is we've met with, over the last 3 months, we've met with apartment owners or that own apartment complexes here in Edina, around the state and nationally. We had a meeting with property managers that manage condos that people own, and this is a huge, it's like for every action there's a reaction. But with this, for every ordinance, there are it gets tangled with this issue. And there's, to Margaret's knowledge, there's nobody else in the state working on this. And to her knowledge, California is the only state where cities have passed ordinances with this, because it's complicated. So we just thought that maybe, by working together with some of these other cities that have this initiative, we could kind of bring all this information together.
Sorry, really quick to that point, Jeff, I don't know if this is something you have an answer to, and I was actually just emailing the group since this jogged my memory, but it sounds like Bloomington's worked pretty significantly with Mitchell Hamlin, the Public Health Law Center, on some of this stuff. And the one thing, I reached out to them and have a contact there that I started talking with, but from the Bloomington side, I can't tell if there's if there's like a monetary component to that, or if as like that, again, whatever the name for kind of this trio of cities is, if there's like a allocation of funds that we're supposed to use, if they, it's something they can do, research and study and, a variety of things. But I don't know where, I guess, our ability stops. Like, I don't want to step on any toes and make sure I'm doing this the right way. So I don't know if that's something where, you have any experience working with them on and can kind of point us in the right direction.
Yeah, if we have ideas about or questions or things we'd like to see done or something like that, we can route questions through Bloomington Public Health for them to make those connections. If you know people, that's great, but you're right, like having things going on in multiple, you don't want to duplicate stuff. So, and I think, I think it's important to remember, especially with this one, is there is, it's a lot of regulatory stuff. Like you think of it as like, ooh, let's make a rule. But we could also talk about incentives or, promotion or education. And Margaret maybe talked about that too. Other opportunities for influencing behavior that aren't regulation. So, but yeah, with those outside connections, we can always talk to Margaret and the outreach folks at Bloomington to make some connections, and so they're kind of kept in the loop.
That sounds good. Thank you. I appreciate it.
Yeah, because she was kind of in favor. She kind of broached the subject about working together. So I just didn't know how that worked.
Anything else on initiative 2? Okay. We'll go on
I have
to
one
the third.
I have one question
yeah.
related to initiative number 2, and it's just a general inquiry question. Across
Yeah.
just different city jurisdictions, are there ownership commonalities? So buildings, may have, common owners across different jurisdictions. And is there a large concentration of that in our areas or not? Or do we have any information about that? Is that part of what you're looking at?
There are a lot of owners that own buildings across the metro and nationally even. We have a few, we know this because my division licenses like swimming pools, rental properties, and lodging facilities. So we have, and underground parking for carbon monoxide. So we have a lot of license information from these companies that own these buildings. And there are a few kind of regional companies that own a lot of buildings in Edina. Premier Properties is one. Multi-Venture Properties is another one that own quite a few buildings in town. But those are all apartments. And as Issa was saying with condominiums, or Michael was saying too, the condominiums are a sticky thing because of that shared living but ownership component. So they are the apartment and condo thing. You almost can't even think of them as the same thing, or even similar because of the ownership thing. Apartments, it's pretty simple. If an apartment wants to go smoke free and the management decides and the ownership decides, they can do it. They just have to figure out how to enforce it. It's not a city rule. Whereas with a condo, yeah, it's a different thing. So, and we've had some buildings go smoke free, like apartments. So there are some that are doing that.
Yeah, I
Thank you.
live in a condo myself, and I know, and if you're not familiar with how that works, just basically we own everything inside, and the homeowners association owns everything outside our doors. They own the building, and so that if they make improvements on the building, outside of our doors, that's their responsibility. I do know that our property owners have made smoking in our common areas not okay. So I do know that that's been done here.
Thank you.
Anything else? Any questions for the second initiative? Okay, let's go on to the third initiative. There we go. Anybody from initiative 3 like to briefly talk about it?
Yeah, only to the extent that I don't think we've really made any real progress. And I think it's more inertia than anything else. I did send an email request for a Zoom meeting and got no response. And I have a feeling that my emails may be going into spam. I know that previously has happened with Amanda. So we really haven't gotten very far on looking at existing programs. I did attempt, because some of the Edina programs would be administered by the Bloomington Public Health Department, because we don't have our own public health department. But I made the mistake of calling on a Friday afternoon and spent about 20 minutes on hold, and then decided to give up and have a glass of wine. And that's my report.
Just was going to add it. Yeah, we haven't had a chance to meet yet, and it's not for Greg's lack of trying. Same thing. I caught it in my spam too. I think it might be it could be the way that the name is filtered. Like, I don't know if it looks for names, but since it has initials, I didn't know if that moved it. So my apologies on missing that as well. But again, like Jeff, back to you for potential guidance. Is with the route that group 2 went with, kind of like talking to Bloomington about some stuff that they've already done. Would it be worth speaking with the same individuals on, again, at the risk of us filling up their entire calendar during the week with Edina, Community Health Commission matters? Is it worth having, the group 3 reach out to them on any input as well? I don't know if there's anything that they're doing in this area.
Yeah, I mean, it doesn't hurt. I'm sure that they're fine with taking a break for an hour from COVID stuff. So I'm sure they would love to hear from people. So yeah, and Margaret might be a place to start. I'm not sure who else. I can try to get a contact if there's somebody on the staff that's the best contact. I can try to find somebody, and then I can email that group.
Okay. Yeah, I get the. Sorry, Greg. I was just trying to find a way. I mean, unless you want that whole time to enjoy your glass of wine, I figured if you could skip the line, we'd figure out a good contact for you.
Yeah, that sounds good. Maybe the thing to do is let me give you my email address and have you put it into your contacts. And then, and it's easy. It's my initials and the town I live in, because if I ever forget my email address, I know it's time to shuffle off to the assisted living facility. So it's GB as in boy, W Edina @yahoo.com. So if you can just enter that in your contacts, then I should be able to break through the spam filter.
And Mary, I know you can read the screen, but the topic is about opioid use, just so you know. Any questions, comments, anything else on those initiatives?
Is our group going to meet at some point? Because when I did my presentation last month, I believe we said something about trying to meet to talk about what else we're going to do with that information. Are we going to meet to do that within the next month or two?
How about we let's connect offline. We'll do that. We'll send an email outside the meeting. Sounds good.
So Julia, this is Mary Absalon, and I do is just defer to the group about whichever initiative needs some additional bench strength. I'm happy to join that group. So if you could help with that, that would be great. I think these are all really great topics that would help our citizens.
All right. Well, I would just say that if there's any in particular that strike your fancy, then just let Jeff, myself, or Andrew know, and we'll make sure that we make that connection happen.
The only thing is, if any of the groups have 4 voting members, we can't have 5 because that's a quorum. So I can't remember exactly, but I can double check. If that's not ringing a
tell
bell.
you that group 1 only has 3 voting members.
Group 3 has 3.
Group 2?
Group 2 would love to have you, Mary, but I think it's also only 3 voting members. So.
Oh, then we're fine.
You're open to anything.
Yep, okay. Even across the board.
Okay, so who said? Who wants me? Or it doesn't matter.
We all want you. That's not the question.
Or where does? I'm happy to. Any of them are great. They're really great.
Well, don't some of the committees have people that are on more than one?
Yeah, I think Andrew is.
Oh,
yeah. I don't know if that spreads Andrew, if that spreads you.
No, that's okay. I mean, since I just did the smoking one, I was going to say if the opioid one is interesting to to you, I can always step away from that one, and you can move into that one with group 3.
So the opioid one. Okay.
Yep.
Okay, that's fine.
Welcome.
Right, sounds great.
Jeff, if you can give us Mary's email address, that'd be really helpful.
Yeah, I'll send out an email to the group.
And someone will reach out to me and knowing the next thing that needs to be done.
Yeah, I'll do that.
Oh, okay.
I'll
Thank you, Greg.
Yeah, I'll send an email so you can reply all, and then you guys can chat on email.
Thank you.
Okay. Well, I'll move on to the next agenda item. Chair and member comments. Does anybody have any? I don't have any comments. Andrew, or does any other member have any comments right now?
I do. I'd like to give everybody an update on how my podcast is doing. I have now published 5 episodes since I started, and to catch our new member up, I just started this podcast in January. I am the sole proprietor and owner, producer, and host of today's Autistic Moment. As I've indicated in the past, it's a podcast for autistic adults by an autistic adult, and that is me. And then I just published my most recent episode, which is Autistic Adults, Our Own Brand, Make, and Model. That particular episode focuses on neurodiversity. Neurodiversity is a word that's come into existence over the last few years. And my dear friend Robin DeCourcy was my guest on that particular podcast episode to talk about what neurodiversity is. And she is a neurodivergent person in that she has ADHD. And among the things we do in that particular episode is we talk about the different types of brains, the quote unquote neurotypical brain, the neurodivergent brain, either being someone who's autistic or someone who has ADHD. And we break that down a little bit as to, you know, what information we have, what are some of the barriers to neurodiversity, and what are some ways that we can self-advocate for neurodiversity. And it's really very exciting. Before I'm done, I'm gonna put my web address into the chat in just a moment. But the other matter that has become particularly enlightening to me over this past couple of weeks is that again, I've only been publishing since the beginning of January, and I publish 2 episodes per month. I've just published my first for this month. But just since January, since I started this, 89% of my listeners are within the US. However, I do have listeners in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 different countries, including Sweden, New Zealand, Netherlands, Poland, Hungary. It's going quite well around the world. So I'm very excited about that. The numbers are small, like 2 to 1%, but the fact that it's already gone there and it's only 2.5 months in is just really exciting. The last thing I'm going to say is that I am going to be hosting a booth at the conference for there's a joint virtual state conferences organized by the Autism Societies of Minnesota and Greater Wisconsin. It will be in April, which is Autism Acceptance Month. And one of the things I'm currently doing through my website is I am having a t-shirt / fundraiser for the Autism Society of Minnesota. And basically go to my website and buy a t-shirt. And at any time between now and April 24th, and I will be donating 15% of the total sales of all those t-shirts to the Autism Society. Stickmoment.com. So there's the web address for my website where you can find more information about today's Autistic Moment, along with my store and lots of other great things there. So thank you for the opportunity to announce and share my progress.
That's great. Thanks for sharing. That is really impressive how many people you're reaching with that podcast and all over. Any other comments? Okay. Jeff, comments,
Sure.
COVID-19 update.
Yeah, so I think between last meeting and this meeting is when the third vaccine was given the green light. So the kind of the feeling around public health departments is that the supply is going to be rapidly increasing, which is great and means more access for more people. We are still working, kind of finishing up the healthcare, childcare, teacher group locally here as far as public health goes. And then we also are working on food manufacturers. There was kind of a question from the state health department about, do you want to do this locally or should we do it for food manufacturing? Well, in Bloomington and Edina, there's only a few places that manufacture. So I got a hold of a couple of them, and they all had gotten their shots except for one employee at one place. So that's going to go pretty quick. And then Bloomington's working on the rest. So it's not a huge number, so that's probably going to go pretty quickly. And then we'll be on to the 65 plus population. And the way that local public health is looking at, or at least Bloomington, Edina, Richfield are looking at that, is we're going to try to focus on groups that may have slipped through the cracks or barriers to getting the vaccine at their primary care provider or through some other means. And so that's going to be the focus of the outreach and kind of targeted outreach, just because our capacity is not huge, and we have the Mall of America site pretty close. So that's how we'll be going forward. Yeah, that's kind of where we're at. So we're just kind of waiting for that to hit the button and start doing that outreach. And there's going to be some of the staff from Richfield and Edina that are not in the health divisions or health departments are going to volunteer to help out with some of those clinics. So it'll be an interesting kind of cross-department collaboration, cross-department, cross-city collaboration. So we'll have, people from Park and Rec doing the registration at vaccine clinics kind of thing. So, but that's where we're at. If anyone has questions or additional comments.
Jeff, I have a question. Given that the administration is now saying that virtually all adults who are going to be vaccinated can be vaccinated by the end of May, in the city administration, has there been any discussion about the potential timing of in-person meetings, because then rooms have to be reserved and so forth? Have those discussions started?
We're starting to ask the question. It has come up about, people, some people want to get back to having meetings in person, and people are starting to ask those questions about what our protocols would be and that type of thing. But I think that's about as far as it's gone.
Okay.
Greg, is this coming off of the new CDC recommendation from today about vaccinated individuals?
Well, I mean, that's part of it, but
Okay.
given, we have some young members who may not even be eligible for vaccination. So,
Right.
My concern was more, when basically anybody can attend a meeting, and, given the optimism about everybody being vaccinated who wants to be, which I wish that were 100% of them. If that's completed by June, the question is, would we be looking at August or September to resume in-person meetings, which, with all due respect to Zoom, I think are probably a lot more effective in getting people motivated to, work together and get things accomplished. But for now, I certainly wouldn't expect any in-person meetings.
Good points. Jeff, anything else? Just that you guys are on 1B tier 2.
Yeah, I guess I don't even know which
It's
letter
one-
and tier things are at. I guess other than COVID, we are in springtime, and that means more people get out and walk around their neighborhoods, and they see things and they call the city. So my department gets a lot of those calls, and so our two rental inspectors that had become the COVID hotline and then started doing inspections some more, but are still the COVID hotline, are also the complaint line. So they are starting to get really busy, which is fine. It's just, I think they've gotten the alphabet soup of responsibilities compared to what, if we had not had COVID, they would be doing. So very interesting, trajectory for them, because they just started before COVID and have done all kinds of stuff that they probably did not expect. So, but we're getting a little busier with that kind of thing. People are paying attention to their surroundings, and that's fine. That's what we do. So, organics recycling. We had a event online called Town Talks that Twyla, our organics recycling coordinator, kind of hosted or participated in, did a presentation. And so we had it's kind of a online, I guess, presentation and question and answer session. And they do different topics each month. Our communications department puts it on. So organics was a topic last month. I think there were 25 people attended. You can imagine most had some critical questions about having the program. But it was good to have the attendance and to give people a chance to ask questions. So that was good. Yeah, that's kind of all I got, I think, unless anyone has questions.
I do not have any questions. Does anybody else have questions? Okay. Anything else? If not, then I can look for a motion to adjourn.
So moved. Tracy.
All right, do
Second.
I have a second? Is that Amanda? Okay. Anybody opposed? Nope, sounds great. All right, everybody. Mary, nice to
Thank
meet
you.
you.
Nice meeting you, Mary.
Welcome.
Thank you.
And see everybody in a month.
Thanks, everybody.
Goodbye.
Bye.